we have more time, we will do some data modeling using our data set from DKI Jakarta, and then final discussion to reflect on the insights gained and address any questions. This session or this workshop aims to foster meaningful discussion and knowledge exchange. So we encourage active engagement from the audience and make the most of this opportunity to learn from our distinguished speakers. Without further ado, let us warmly welcome Professor Daniel Gartner. The stage is yours.
Terima kasih banyak. Nama saya Daniel Gartner. Selamat siang. That's all I can do in Indonesian. Yeah, it's a pleasure to be here. Really, thank you for the invitation, and it's a great honor. So, I want to talk a little bit about my journey. Why? Because some of you, they have probably a different career. Some of you may be still students. Actually, I'm not originally from the UK. You may hear from my accent that I don't have a British accent. I have a German accent, a German-British accent. So originally, I'm from Munich, where I did my PhD. Originally, I was born and raised in southwest Germany, which is near the Black Forest. Maybe people know the Black Forest Gâteau. They like the really nice cake, sweet cake, cherries, cream, chocolate sprinkles. That is Black Forest Gâteau, Black Forest cake that we have there. And my mom bakes it at home, and my grandmother, like everyone, loves Black Forest Gâteau. So when I moved to Munich, I started a data science project and a patient scheduling exercise. So this was, I used a technique in mathematics called discrete optimization. And then I moved to Pittsburgh at a private university there, where we looked into an information systems problem. You know, sometimes when people arrive in the hospital, patients arrive, the clinician can select in their information systems back in Pittsburgh, they can select what to prescribe. And sometimes they have an order set, like a set of activities that the patient will get. For example, the patient will get bed rest, check, patient will get liquid diet, patient will get this and this and this medication. And these are already order sets that are put in the information systems. Maybe this is something that you use in Jakarta as well. I noticed not many countries use this technology, but sometimes it can be really useful for clinicians, for doctors, or for nurses to prescribe these things quickly, rather than finding this and this and this. Oh, and this needs to be prescribed, and then, oh, this needs also be prescribed to the patient. So this is where order sets, this is what I did here back in Pittsburgh, something that was really, really useful. And then we applied for funding, and we had PhD students later on. And then, yeah, I moved up in the department to senior lecturer and then chair of operational research. What I'm currently doing, besides like traveling to Indonesia and so on, currently I'm an editor for a journal which is called Health Systems. So if you look up in the internet, type in Health Systems Journal, you will end up at the Taylor and Francis publisher site. And then you will see that Health Systems is a journal that publishes all sorts of research on the intersection between different parts of the health system. For example, hospitals transfer patients home, and then you need to look at the transport problems to solve. So this is what Health Systems Journal does. And I can encourage you to submit articles to the journal, because it really publishes public policy work, information systems, mathematical modeling, all these things is published there. If you have a paper and think, oh, is it good enough or not, contact me. I can help you maybe to kind of shape it and so to make sure that it goes peer review and to the journal. So I just want to say I'm an editor for that journal, and if you want to publish good work, I'm happy to help. So the workshop now is split into two parts. We have one part that just looks into basic functions, maybe a refresher. Some people know pivot tables, some people don't know pivot tables. Does anyone know pivot tables already in Excel? Yeah, okay. Some people maybe not. Pivot tables is new. Or absolute referencing, or yes or no, maybe. Some know and some not. Okay, so I think I gave a complete refresher of what is going on with pivot tables. Why are they so useful? Some people I notice in our national health services in the UK, some people would do all sorts of different manual calculations, but there is help with these pivot table or automatic functions like lookup function, H lookup, count ifs, conditional formatting. I just want to go through these things in the first part here. And in the second part, I think I want to talk about optimization of resources. And optimization of resources, that means we use the Excel built-in solver to show you how you can better allocate your resources. For example, how to better plan shifts in your department, like shifts of people working in the department. You have a demand curve and you want to align the capacity with the demand. So some people are part-time workers, some people are full-time workers, some people work Monday, Wednesday, Thursday, other people work Friday, Saturday, Sunday, etc. So what we want in that tool that I give you, and we have already distributed, I want to show you how you can use that to make effective decisions in healthcare. Or within a day, some people work from 7 in the morning until 2 in the afternoon, other people work from 8 o'clock until 4 o'clock in the afternoon, others work a night shift. How do you select then who works when to mimic that demand function? So, because you don't want to waste capacity, you just want to be as close as possible to that demand function with your available members of staff. And then I have also for you a little scheduling problem, which is a problem where patients would be on a waiting list, have an eye care measure. That means some people are under risk that their health deteriorates, health gets worse. Some people health wouldn't get worse. Some people are long on the waiting list, some are short on the waiting list, some are far away from the hospital, some are close. And then what we want to do is we want to find the best mix of patients to schedule in. Obviously, some people won't get an appointment in the next, let's say, 3 weeks or 4 weeks, but we want to find the best mix of patients to schedule in so that their eye measure doesn't deteriorate, that they're not traveling too far, and that they are not waiting too long. It's like a multiple criteria problem. So this is all, I think, what I can share today in the second part. And I also have a little routing problem, like how things are distributed between different hospitals, so we can study that as well with the Excel solver. So this is then coming to the learning objectives. How can we make sense of data? How can we plan our resources better? So this is a little whistle-stop tour about what we are doing today. I have this picture for a reason, because that's what Paul Harper said in the morning. We have variation everywhere. Like some people stay long in a hospital, need a long recovery time, some people short recovery time. We have male, female patients. We have people who live far away, live close, and all these people have in common their demographic and clinical attributes that they share. And we have attributes that we can break down into different types of attributes. We have nominal attributes, which are city, Bandung, Pangkal Pinang, Jakarta, etc. We have gender, sex, male, female. So these are nominal attributes, and you are probably not be able to calculate an average from these nominal attributes. So there is no average between male and female. So male plus female divided by 2 doesn't make sense. But we have also ordinal attributes, like exam grades, mobility scores, deprivation score, and then we have continuous attributes, height, weight, temperature. These are kind of different types of attributes that we observe in our data. So that's just a little refresher on our levels of measurement. And what I want to do now is I want to go into the first data set, which is in the files for participants zip file. I think that was sent around, and I open the exercise.xlsm, and then you see in a second, I'm just screen sharing now. So this is the data set that we are focusing on now. Okay, so I can make that a little bit bigger if you like. I can go and zoom in. And what you see in the data set is we have admissions. So people arrived into a hospital in 2019. And we have April data, May, June, and so on. So they arrived, they were discharged, they have a gender, each line by line. Each line is a patient who came. Then we have a distance, how far away did they come from the hospital? And why is that important? Because our ambulance service that brings the patients into the hospital, they wanna find a little bit where they should locate the ambulances. Should there be 10 ambulances close to the hospital, or 5 hospitals very far away, and 3 ambulances like middle far away? And what we want is we want to populate months, year, length of stay, whether they are far away or not, and a kilometer group. So this is actually all described in my lecture notes. My lecture notes, they are here. That is file under file 1, lecture notes. You see that everything that I do now is written really, really step by step in this lecture notes file. So like how we do, how we can get the month from the data, how do we do absolute referencing, formatting the data, conditional logic, data manipulation, etc. So this is all described in that lecture notes document file. Okay, so I think I make a start now, and if you just familiarize yourself with Excel, and what I often see in people, like being in Excel the first time, people often forget to put the equal sign into the like in the equation editor on top. So what I then say, okay, if you want to just calculate 5 times 2, put the equal sign, and then 5 times 2, 10, or another one equals 10 divided by 5, etc. So you can just make sure that you always use your equal sign before you make any calculation. And sometimes people don't know the equation wizard, which is also useful. So if I want to calculate, for example, the month here in my data, what I want to do is then I maybe want to ask the function wizard and type in month, and then I see here in my tooltip or in my result, month, serial number, returns the month, a number from 1, which is January, to 12 December. Yeah, go ahead. Yes, of course. Uh-huh. Yeah. Yeah, if you probably you haven't downloaded it maybe yet, but yeah, just download what I have shared. The file is called the file is called exercise 1. Yeah, exercise 1. Yeah. Yeah, yeah, brilliant. So, what is the function name? I can't remember. STDEV, standard deviation function, or average function? Is that what was the name again? Then try to find here with the equation result, and then it tells me returns a month, a number from 1 to 2. Already experience in some programming languages, it starts with 0. In the language, they have value 1. Open bracket, and then the month is in probably in the A column, A2, yeah. So we want to know that the month of the arrival date. So in A2 is the cell of our arrivals, and then equals month, open bracket, A2, close bracket. That should give us the proper arrival date. I think I'm a little bit behind with here. So okay, so it catches up now. Good. So on the top left, you see the month. Yeah, so top left you see month A2. So it's a little bit behind because of the internet connection, but okay. So now you don't want to do that all the time for every cell. Equals month A2, equals month A3, equals month A4, equals month A5. So what you do is you just double click on that little square underneath the 4. And when you double click on that, it would fill automatically all the way down to the end of the spreadsheet. Yeah. And to make really sure that it's gone all the way down, you could either use your wheel mouse, and usually in the room, I hear the whole room. But, so I can do it as well, and go all the way down. But you can also do it with control and arrow down to go to the end of the spreadsheet. So control arrow down, and now you see I have reached the end of the spreadsheet, which has 1,262 lines, which is, it has done that automatically. No, that's good. So that control arrow down works also upwards, control arrow up. So that's how you get to the very top of the Excel file. And now we populated the month. I think the year is pretty self-explaining. We do equals year. We can skip that. You know, probably it's quite straightforward. But how do we calculate the length of stay? That's the difference between the discharge date and the arrival date. So let's do that together. Equals B2, which is the discharge date, minus A2, and that would give us 17 days length of stay for the first patient. Let's have a look whether that's correct. Yeah, that should be correct. And then we can double click, and that fills out everything automatically as well. Sometimes I just look with control arrow down whether everything has been populated, because sometimes you could have just a value or something in the middle, then it stops. But it looks like, yeah, it has done the job, and it's gone down. Now, the next function that we use is an if-then-else function. So the if-then-else function works like, and we want to know whether the patient lives too far away. And you could say, well, if the patient lives like further than, or the call was more than 20 miles or kilometers. I think here you have kilometers, like we in Germany as well. Why would you have miles? Oh, yeah, good. We have something in common. Good. Yeah. So let's say more than 20 kilometers is too far away, because by the time we are in traffic, patient will have died. So it's no need to send an ambulance from our base there. We should call them to bring the patient into the hospital where they are at the moment somehow. So equals if, and then actually we could go into the lecture notes, which is here. So the lecture notes say with the if-then-else function, consistent. So if the patient, it reads like, if the patient has been 15 kilometers or less than 15 kilometers away, that qualifies them close to the base, so we would go there. Otherwise, it's too far away from this, and is that is the copy, yeah, not coffee. And we just put that in here, and this means with 19 kilometers, the patient is obviously too far away from the base. I just wait a second. Yeah, now it's there, far away from the base, and we can do that with double clicking on the bottom right square in our Excel cell, and that would populate everything all the way down. So the next column is the kilometer group. We want to not just have too close to the base, too far away. We would like to look into kilometer bands. So not 0.14 kilometers, not to 14, 15 to 64, and then more than 65, 65 kilometers or more. And what we could do is now with a function that we just learned. Oh, I make it bigger. Yeah. So with the kilometer bands, 0 to 14, we could do an if-then-else as well. So like if that was, if the value from the kilometer column was this in this category, we could do this, else this, and then else that. So we could do an if-then-else with a lot of stuff in it. But there is an alternative, and I show you that, which is the lookup function. And the lookup function is doing the following. It looks up the value, the kilometer value, and it matches the criteria that is served with the results column. It just catches up a second. But what it do is, or what we want to do is in cell I2, we will just then, and I'll explain that in a second what that equation does, or what that formula does. So here is the lookup D. So the curly brackets, they match then from 0 to 15. So that is here actually this from 0 to 15, from 15 to 65. These are our interval bounds. And we match these values that we want to display with these interval bounds. So, I mean, a different example would be if we had length of stay, like short length of stay, middle length of stay, long length of stay, and then very long length of stay, for example, if we had 4 values or 4 cutoff points. And with this one, these are 3 cutoff points. So first cutoff points of the 3 intervals. So we have from 0 to 15, 15 to 65, and then 65 plus. So this is what these cutoff points are, like in our continuous measure. And with these ones, these are our text, what we want to display. So here we could say close, not close anymore, and then here very far in these quotes. But if I hit enter, then this would give me then the 15 to 64 kilometer group, because we are with D2, with that cell. What are we, 19? So this is middle, far away in the 15 to 64 category. So I could also say, actually, I don't like the not until 14. I could say, oh, this is super close. Oh, 1 second. I could say, actually, I don't want it to be called 0 until 14. Maybe I want this to be called very close, not close anymore. And then you could say here extremely far. So this is what we could also say if we didn't want to use these 3 categories. So that's basically what we write in the in our function, the match between these 0 to 15, 65, etc. Also, maybe we want to say, we don't want to go from 0 to 15. Maybe another city like Bandung, that's maybe not to 15. Maybe that's not 0 to 10. And then maybe 30 kilometers, that's already considered far away. Then it would be different intervals, obviously. And then you would double on the little square, and then you can then say, okay, I double and I want to fill the I column automatically with my with Excel. That would say not close, extremely far, etc. But something you may see then is, okay, if I have 4 or 5 or 10 categories, and to maintain that can be really time consuming. And there is a better way, which is the HLOOKUP function. And the HLOOKUP function that uses a different table, that uses a table that you can parameterize and manage easier as compared to having the function always in the lookup or in the function up there. And the way to do that is written in the in the booklet. Oh, sorry, it's VLOOKUP. So the VLOOKUP function is doing that. And you will use the VLOOKUP function and you can plug that in, because what it would do is, I'll just make that big. So in that cell, we do equals VLOOKUP, and then the D2 value, which is what we want to look into, so the kilometer distance, and then what else do we have in that function? K15 to L18, and then 2. So I explain what these two mean, like K15 to L18 and 2. So in K15, I got this table, so the kilometers table here, and the kilometer table does exactly the same what we did with the curly brackets. So we said, oh, these are the intervals, and this is the text that we want to display. If we find a value between 50 and 65, we take this value. If we find a value that is greater than this, we take that value. And this is basically the VLOOKUP function, which is quite handy to use. Okay. So this is the part where we had the here, so we can populate that automatically. But there is something that I wanted to tell you with these dollar signs. Sure, Microsoft is a US company that likes maybe the dollar signs, and I'm maybe more a fan from the euro signs. But if I do the magnifier, and then you see here these $K $15 colon $L $18. So you may think, okay, why do I need these dollar signs here? And there is a reason for this, because the reason is called absolute referencing in Excel. So if you remove them, I can do that quickly. So I remove these dollar signs. And a way to remove that is hitting the F4 button on your keyboard. So if you click on one of these cells, so just click on K15, for example, and then you do the F4 button, then it would add the dollar signs automatically. So you don't have to write literally down $K $15. You can just hit F4, which I'm doing in the next one here as well. So if I hit F4 on my keyboard, then it does that automatically for me. But I want to show you what happens if I don't have these dollar signs. And I'll show you, because that's a big mistake that many people do when they work with Excel. So here we got the dollar signs, but in the next one, in the next cell, we don't. So on the top we have not the dollar signs, but here we got the dollar sign. So I just fill the. I just do double click on the bottom right. So what I did, I was double clicking on the bottom right square to automatically populate until the end of the document, which we did before, right? We did that before. And now what you see is that the first one is still correct, K15 18, which is that window from our lookup table. But the next one goes from a 16 to, what was it? L19. So Excel thought it's clever but maybe too clever. So it moved that window further down. So just one cell further down, or one line further down. And then with the next one, here, it goes K17 to L20, and even worse, K18 to L21. So it goes further down, which we prevent from doing by inserting these dollar signs. So remember, one thing you should remember from here, put these absolute referencing, these dollars, into your function. So just to prevent that from happening. So we do that, we go back and do this, F4 here, and F4 there, double click on the little black square, and then we can scroll all the way down and see that it's still K15 to L18, which is what we had before. Good. Yeah, go ahead, questions. Questions are welcome, yeah. Yeah. Yes. Okay. 1 second. Uh-huh. Let me have a look. Yes. So I think maybe it depends on the Excel version, but this comma and maybe this comma, yeah. But don't change that colon. Don't change this. Yeah. Okay. Yeah, you're welcome. Yeah. Any other question? Okay. Good, good. It's maybe an older Excel version that you have or an international version. I don't know, but it's true it happens sometimes. Okay, that's the VLOOKUP function, something really useful, and I hope people use that now if they haven't done so far. Yes. So shall I have a look? Oh, really? Okay. Shall I have a look? Or? Hey, Bob. Oh, amazing. Yeah, so with the dollar sign, so you'll click the dollar sign once, and then it would put the dollar signs, I think, in front, another time to the other one, and then another time to both. So $4, $17, for example. Use the dollar. Do use the dollar, please. Yeah, yeah. Because if you don't use the dollar sign, if you copy down the next and down the next, it would shift this further down, which you don't want. But I see this often occurring, and people are confused. Why do I do that? And then they would stop using the lookup function and do calculate all sorts of things manually. But I think you should really use these built-in functions to, yeah. So just use the dollar signs. Yeah. Okay, good. It's called absolute referencing. I don't know why it's called absolute referencing. Maybe because that's an absolute. It's absolute, must be there. Yes. Yeah, absolutely. Yeah. Yeah, true. Unless, yeah, which we did with a month, yeah, or yeah, yeah. Unless you really want to, yeah, exactly, yeah. Okay, thank you. Yeah,
Bapak Ibu, dari tadi yang diajarin Profesor Gartner, terutama tentang rumus-rumus basic Excel kan ya. Jadi ada rumus lookup, VLOOKUP, if then else. Nah, untuk sejauh ini kita bisa lanjut, karena kita sebenarnya kan intinya tentang data modeling ya. Gimana? Lanjut ya? Lanjut ya?
Okay, terima kasih. Um, yeah, so some people, so remember we were thinking, what was the research question? We were thinking how many people, come into the hospital from far away, from close, but we also want to find out, for example, come in the rain season, how many come in winter? No, what is it? Rain season and not rain season? Rain season and dry season? Dry season, yeah, yes. Yeah, of course, yeah. So, yeah. So what we want now is to calculate our attendances. So, and the attendances in each month use the COUNTIF function. COUNTIF is equals COUNTIF open bracket, and I think we use the D column, so I use D, $D, and then I have also a criterion. Is that correct? COUNTIF, range, comma, criteria. So how often is April in that column? The April is the 4th month, and then we hit enter, and obviously it should be more than 4. So if we go, no, it's not distance, it's months. So it's the E column, E colon E, right? Comma 4, close brackets, and then you should have 462 times patients coming in from April, or in April. And you could also come to the same result if you said, actually, I want to do from E2 all the way down to E1626. So this should be the same result. But now, if you did it that way, and if you just copy and paste, what it would do, and I use the magnifying glass because this is something really useful now to show you why the absolute referencing is now again really useful. So here, I just copied that down, and you see it's now going COUNTIF from E3 to E1627. And if I do that again, I'm not sure why it's not marking. Yeah, okay, now, so you see E3 to E1627. So I missed the first row. Okay, what do I do now with the next one, with June? Okay, I go to June, copy, paste. And sorry, the May is of course the 5th month. And June is obviously the 6th month. But what it does now here, you see it's going from E4 to E1628, which is even worse. So it misses the first 2 lines. And what we should have done in this case, we should have done the absolute referencing, the dollars. Yeah. Like it or don't like dollars. Again, my euros are much better, or not, who knows. Or yeah, rupiah, yeah. So, but what we should have done here is F4 and let's have a look, and F4 again. So here, if you have done that, you can safely copy and paste and just modify your months to 5 and 6. And these numbers should match up with the numbers that you have, hopefully. Yeah. Okay. So now, with this one, it's good to know, you know, in April we had less demand, obviously, than in June, and in June we had less demand as compared to May, so May was the most busy month. But we could have done this in an even easier way, which is where now the pivot tables come into play. And the pivot tables are located in your data tab. Yeah. Yeah. And the data tab is located on the top. There is File, Home, Insert, Draw, and one of them is Insert. So we want to do the Insert tab. Yeah, I think my coffee takes a little bit to really work. Sorry. So the Insert tab, there is Pivot Table. On the top left of the Insert tab, you see Pivot Table. So you click on that. So you probably want your cursor to be in the data set in the left. Pivot Table, and then it asks you what table or what range should we consider for slicing and dicing our data set. And the data set is, you know, all the way from the left to column L. And the last line we should have here consistently is 1626. I'm using the magnifying glass just to show you how it should show on your computer.
Kak, punten, ambil obat. Sorry, thank you.
Yeah, that's true, but how do I share on the call? Like these 100 people, or how many do we have in this room? So this is what you should have in the pivot table. You click OK, and then it comes up with a new worksheet. So on the bottom there is a new sheet, sheet 1 probably in your case. And on the top we have a beautiful pivot table 1. To build a report, choose fields from the pivot table field list. So now I should also say or tell you a little bit of an anecdote. People sometimes don't know what they actually want to learn from the data. Sometimes people, they open the pivot table feature and then they push and try to do something, but they have actually not really thought about the actual research question. And the actual research question is shown in the lecture notes. And in lecture notes, you see this table skeleton. I think when you work with your data, when you have a big data set, first try to find out what is the actual question that I want to ask or having answered with my analytics toolkit. And what I want is, I just want to think about, I would like to present my executives a table or maybe a graph, which we do in a minute. I want to show my executives a table because this should all go in a business case that they read through and make better decisions, using our data. So I want them to understand that actually I want to have the kilometer bands and female male, because they should understand that maybe we should have specific ambulance services for that particular population or this particular population, or they want to understand who is coming from further away, who is coming from close, near the hospital. So this is why it helps then to just use a little piece of paper and then write down in my rows, I want to have this, in my columns should have that. And this is in the pivot table where we use the columns and rows. And the actual question marks in the documents, they were our attendances, like how many people on average come into the hospital from these different types, from these different kilometer bands. So what I do now is I have the, what did I say, female, male, so the gender in my columns. And in my rows, I want to have the kilometer bands or kilometer groups. So like this here, if I use my magnifying glass, you see how it should look like. Female and male, grand total. And on the bottom right, what I have done, I have pulled, I've taken these guys, I clicked on the mouse button, pressed it, and pulled it down to columns or rows, right? So I can still remove them. So gender, I pull gender to the columns, and I pull my kilometer group to my rows, and what I want is also the values, which is the sum. Actually, this weird symbol next to values, that is a sum symbol in maths. So what I do is I pull that to the values, and instead of summing up the length of stay, I want to know what is the average length of stay that people were, how long were people in the hospital. Because I think I want to know how long people stayed. Is there a difference between male and female patients in the length of stay? Male patients who were close to the hospital, they stayed shorter than female patients from far away, or the other way around. So we count the average. So we use the average, and then we see, okay, what does it tell us? It tells us that we could do this, like some decimal place as well. Our data set or our analysis reveals that female patients from not too far away stay shortest, while the male people who were close to the hospital, they had the longest length of stay. So this is what our kind of analysis reveals now, just with a simple pivot table. But had we used COUNTIF function or we could have done that manually. We could have, copied data to another spreadsheet and copied the male data to the next spreadsheet. We could have sorted and done all manual tasks. I think that would have taken probably 15 minutes or 20 minutes. But with the pivot tables, that is just 4 clicks, I believe. 1 click on pivot table, 2 clicks column and row, 1 click for the average function, maybe a 5th click to say, okay, I want to calculate the averages. So that's maybe 5 clicks, and you have that nice table that is already, I think, presentable to the execs and put into a business case. and now you might think, oh, okay, some executives or some people in my organization, in my, somewhere on the top floor, some people, they might be more visual. They might work more using charts or like pictures. Yeah.
Bapak Ibu, kayaknya tadi agak terlalu basic tentang pivot table. Jadi tadi saya minta ke profesornya untuk kita lanjut aja bahas tentang fitur di Excel yang solver atau analysis tab. Kita langsung ke situ aja ya, karena kan udah jam 2 ya, takutnya nggak cukup waktunya. Bisa ya kita langsung ke sana aja. Jadi tadinya profesornya mau bahas grafik, tapi takutnya nggak cukup waktunya. Jadi kita langsung aja boleh ya? Atau grafik sebenarnya udah pada bisa kan? Nggak perlu diajarin kan ya? Kita lanjut aja ya ke solver ya. Oke, terima kasih.
Yeah, okay. So, okay. So here, it's already. So I'm showing you a technology called Excel Solver, and sometimes I think I start with that. It reminds me a little bit going to a holiday, or packing my things, packing my bag. And sometimes you think, what should I take with me today? Shall I take my children's bike even? Shall I take all the different toys? Shall I take the surfboard? Shall I take food? And, even my kids maybe, or I leave them at home and I just go alone. But you will end up, like you often do in life, by making choices. What shall I pack into my life? Sometimes I think, shall I study medicine? Shall I study business? Shall I do all? Shall I? So this is life. Life is short and resource constrained. So what we have here is a problem that is called in mathematics Knapsack problem. But I don't want to bore you with all the maths. In real life, in medicine, we have an operating theater, which is limited in capacity. We have resource requirement of patients, and they have been on the referral waiting list, and there's a clock ticking in terms of the weeks. Some patients have been on the list for 4 weeks, some for 90 days, some for even 1 year, 365 days. So this is a little bit the analogy that I have. Our operating room has a fixed capacity, which is my car trunk, space, and the importance to the driver is the patient's like longer or shorter waiting. Sometimes you may have a car that allows extra capacity, or even a trailer, or even some funny other things happening. But sometimes you just don't have that extra capacity. You have a limited capacity that you want to fill with your patients. So what I got a tool for you that solves this problem. Because if you didn't use the tool, just having 10 patients would lead to 1,024 combinations how you could fill your capacity, and you don't want to figure out, whether patient 1, patient 2, or not patient 3, but patient 4, etc. whether they could be scheduled today. So I can probably go over that quite quickly. What the tool is doing, it tells you then who of these patients would have access to the operating theater. Should this be, these 3 patients out of 4 patients, or should it be other patients? Because if you had that problem, which tries to maximize the capacity utilization, you have only, this slack, this white kind of space on the back here. However, in this case, you have still a patient who is 42 days on the list. This would mean that you have kind of solved a different problem by maximizing resource utilization. So if you want to go to that Excel spreadsheet that is called it's called Operating Room Scheduler. So if you go to that spreadsheet, then you will see I got here, now I have been on the 10 days for patient 1, 20 days for patient 2, etc., etc. Each patient has a capacity requirement, 60 minutes, 30 minutes, 45 minutes, 55, and so on. So we assume that we have a team of people in the operating theater that can predict very well the amount of time that they need in the theater. Obviously, in reality, this patient may be 65 minutes long, or that patient may be even not turning up. That patient may require even more surgery duration, like 300 minutes, because it turns out that the surgeons will discover this and this and this during the surgery. So this can happen, that it's longer or shorter, but only the deterministic problem that doesn't take into account stochasticity, that is already quite complex. So what we want is actually, we want to know who of these patients do we want to schedule. Shall we schedule patient number 1? Yes. Patient number 2, maybe not. But patient number 3, patient 4, no. So 0 means no, 1 means yes. And what I did here was I thought, okay, I use a nice fancy function in Excel, which is the sum product function. And the sum product function, that is doing the following. It multiplies the first vector, the first vector is E7 all the way down to E15. And the second vector is G7 all the way down to G15. So it multiplies the first from the 1 with the first from the second, the second with the second, the third with the third, and so on. So one multiplied with one another, and then it sums everything up, because that's called sum product. So it's a product of the sums. Okay, got you. Everyone is with me. And I do the same with the capacity required. So if I show you that, because we want to interrogate, we want to question, okay, who do we schedule? The first, the second, obviously here not. The third we schedule, so we multiply the surgery durations with scheduling the patients, yes or no. And that gives us the total required capacity. And in this case, we have 480 minutes available. And here we, because we schedule, let's say, this particular pattern, then we see easily that this is changing automatically. If we don't have anyone, we can just check what happens then. No capacity required. If we scheduled everyone, then we would see, oops, we got 594 minutes required, which is way more than the actual capacity that we have available. Yeah, sometimes people would have different heuristic algorithms. So sometimes people would say, okay, the guy with the longest RTT value should be scheduled first. So we could do that. So let's do this. We schedule this person because that has 120 days. Second biggest is the 80. We schedule them as well. And then we look after the 60 days patient. What happens then? And then maybe the 22. And then we could have the 20. And then we should actually check, do we have enough capacity? Yeah, we still have. And then we choose, what else do we have? The 13. And then we have 210. So maybe this one, 461. But yeah, so maybe we can shovel that in. Oh, oops, we have 521 capacity required, which is too big. Okay, so maybe maybe this is the best that we can get. 461 and 325. So maybe we just make a note. 461 capacity and 325. So let's see whether that is optimal or not. So we can verify by using a solver. So in the data tab, there is something which is called solver, and this is on the top right of the data tab. I can use my magnifying glass again. And you have a check whether this is there. If it's not there, then you can install, which is easy because you go to your File tab, and in your File tab, you go all the way down to Options, yeah, File, and then all the way down to the Options. And in the Options, there is something called add-ins, because the solver is an add-in. So add-in, and in add-ins, you will see Manage, and you click Go, and then you see all these different add-ins, like OpenSolver here. And another nice add-ins is the Analysis Tool Pack, which is also in the lecture notes. So the solver add-in, you make sure that it's check-marked. And then if you click OK, so if you click OK here, then you should have that installed on your data tab. So File, Options, Add-ins, File, where was I? File, Options, Add-ins, Manage Add-ins, Manage Excel Add-ins. Actually, you hit Go, you make sure that Solver Add-in is checkmarked. I have another OpenSolver, which is even more powerful. I can explain more, but make sure that you check this, and then in the Data tab, you should have the solver. OpenSolver. If you don't have the OpenSolver option, that's no problem at all, because you only have that if you have installed or downloaded it from somewhere else. But I can tell you something about OpenSolver in a minute. Okay, just the normal solver. Solver add-in, yes. Okay, so when you click on solver, when you click on Solver in your Data tab, then this dialog will open. And what does it tell us? What does it tell us? It says set objective. It says max, min, value of, by changing variable cells and all these things. So what we want in our optimization problem is we want to minimize how long patients wait, isn't it? We want to minimize how long these people wait. And we want to change the variable cells, which is our zeros and ones. We want to tell the computer, do that for me, find the best 0-1 combination for me. And this 0-1 combination is binary, so 0-1 binary. And then we want to avoid that we exceed our capacity with this L10 less than equals L6. So so if you install OpenSolver, that's what you can do at home. You can do the same. It's a bit more complicated, the relationship with all these. Yeah, you would have to download, and it takes a little bit longer. But it's open. It's free. Yeah. So I show you. Oh, I would recommend download OpenSolver, but not now. I think you can do that at home, because what we do today, you can use normal Excel solver for the stuff we are doing today. But if you have a more complex problem, use OpenSolver, because Excel solver can only handle, which is not a lot, but still usable for smaller problems. No. You download that from opensolver.org. I can show you. One second. So OpenSolver, I think it's .org. And if you download that, you see then the same here with this fancy into, either you can actually use Google Sheets for that as well. So you can share your Google Sheet with your colleagues and say, okay, also can you run what you want to do is you download and install, and it brings you to another homepage to here, OpenSolver 294. I think there are even newer versions of it. So in SourceForge, that is the download side. Then you see here linear. If you have a Windows computer, download that. The zip package, manage and that with it. It's all nicely described in there. Yeah. Only if you have like more complex problems. You use the normal solver, yeah, the normal Excel solver. So I click on Solver, Solve, and then it tells me Solver found in a solution with tolerance. All constraints are satisfied, which is great. And then what I see here, RF and 461. Here is an even better solution, 327 to 473. I mean, our approach was already good, but this is even better. Yeah, so this is one tool I want to share. The other one is a little staffing model. And this is the file that is called HSDU staffing across 1 week. So if you have a operating theater in your hospital, then you also have to make sure that all the scissors and knives and things that surgeons and the team use in the hospital, they are decontaminated, sterilized until they go back to the theaters, right? what you don't want is you come as a patient out of the theater and you have an infection because the sterilization and decontamination unit disinfects and sterilizes everything in autoclaves. So this is what they do there. So we had a project some time ago that had, I think, 25 different patterns to manage their staff. Some people were on part-time, some people were full-time contracts, part-time 20%, 80%, 60%, 43% contract, whatever. And in this tool, what you can do is you can work out how to match the capacity with your demand. So suppose on Sunday, because Sundays are not really busy days in your theater, you only need 17 people or 13 people in your sterilization unit. But on weekdays, because you have more demand and more things have to be sterilized, that means you need more people there. So suppose you have your people that don't work on Saturdays and Sundays, so they work Monday through Friday. These people work Sunday and Saturday, but those people are on part-time shift. 80% work on Thursday, Friday, Saturday, and Sunday, but the rest of the week they don't work. So what that tool is doing, it matches the it tries to find the best mix of employees for ensuring that you have enough capacity. And this could be on your whole operating theater as well. So if you have, let's say, 7 theaters, every theater has to be available Monday through Friday from, let's say, 7 o'clock to 3 p.m., but Saturday and Sundays they don't work, or maybe only one theater works. So this is transferable to other things in your organization. It could be, you have schools and people are on part-time and full-time contracts. You want to make sure that people, have, let's say, work from Monday, Tuesday, Wednesday, etc. So obviously your teachers that look after your children, they need to be assigned like through the whole week, etc. But I mean, yeah, this is kind of transferable to other service industries, if you like. But what the solver does, and what this model is doing, it multiplies these number of employees with a different shift pattern or staffing pattern. And the solver, if you click on data and solver, it minimizes the number of staff, which is D18, tries to bring the number of staff as close, as minimum as possible. But this constraint ensures that you have enough capacity built up. And if you click on that solve button, then you will see, and I closed the other window, then you will see that here in this case you need 37 people to run that service with a minimum, like the minimum capacity basically, that is ensuring that the demand is satisfied. We could have done this manually, and you could say, okay, I could start with 0 employees, and I could do that manually and think, okay, so maybe I need here on that shift pattern, what is my maximum here? 23. So I maybe start with 23 people. So that means I'm okay with a whole week, but then 17 and 13, maybe here I need, I have 17. Maybe this is, because this is obviously safe in terms of my capacity. So 17 here is good. We have 23 people, so we have 3 more than actually required. 23 is good. 23 here is 1 more than required. And then here we have 2 more than required, way more, like more than twice as many. And here is also fine. But you see, with that simple approach that we did manually, we are not optimal. Our solver showed that we can even bring that stuff down by 3 people more, 3 whole time equivalents probably, to give us a utilization of like 88 or something, or 89%. So that is another tool. We got also, how much time do I have? Shall we do another 20 minutes, or is that okay? Or until 3 o'clock?
how to do the solver feature. Yeah, I mean like what cell to fill in this field, like.
Yes. Okay. What cell do I fill into a field is the question. So I think we could start with a new problem type. So let's think about a patient scheduling. Do you want to use your data set? Yes, of course. Yes, send it to me. Yeah, okay, okay. So yeah, let's do your data set, right? Cool. I think I already saw a little bit of it. Yeah, I just download that. Good. Yeah, I think it might be useful. So, okay, so assume we have January, February, March. What is that? Attendances in ICU. Yeah. People come into ICU, and we want to find out how many nurses do we need, or in the hospital. Okay, so I don't think you need the solver. I think in this case, is the ICU beds, is there only one type of beds, or is it the same, all beds are the same, or do we need more critical beds and less critical ICU beds, like step down ICU? Yeah, okay, okay. Yeah. And is only beds that you need, or is it also, because here you have number of ICU medical staff, 1, 2, 3, 4. What is the relationship? Why is that 4 here? Is that because you have more demand, or do you know why is it 1, 2? Uh-huh. Yeah, yeah. And do all the doctors work the same shifts? Do they work part-time or full-time? They are full-time? Okay, uh-huh. And do they have, yeah. Yeah. Okay, some introduction. Okay, I can introduce it more. Yes, of course, yeah. Yes, okay. I think I go back to the patient scheduling model that we had before, and maybe I just do a blank sheet. Remember we had patients, 1, 2, 3, 4, 5. We'd have, maybe in this case, we could say intensive care unit need, like ICU capacity need. So who should go? Maybe in this hospital, maybe we have that particular hospital, we need, for patient 1, we need days ICU, this patient needs 5 days in ICU, or we could say hours. Maybe is hours better? Days. Okay, good. ICU capacity need in days. Maybe 1 day, 2 days, 8 days, months. Okay. Maybe like 28 days, 31 days. We could then say here criticality. So this is very critical. This is not so critical. This is less critical. This is maybe more critical, and this is like this one. We could have these patient kind of criticalities, or we could say also people or patients coming from the distance. We could also say maybe we could say instead of criticality is maybe distance more important. We want to minimize the distance where they come from. So maybe like people who are far away, that we want to prioritize them, or a mix between criticality and distance. And then, yeah. Yeah, monitor needs. So this patient may need a monitor. No, yes, and yes. And here we could say actually this could be the patient types, and we do a little bit of a case mix problem, and then how many of them do we put into our mix? And we could say actually we do 5 of this type, 3 of that type, 8 of this type, 9 of that type, and 33 patients of this type. And we have maybe the total ICU capacity, and we could have the ICU capacity in total maybe 2,000 bed days. And what the model would do is we would do a sum product between this and that, the ICU capacity needed. So that's capacity needed. And then with another sum product function, we would do the distance. How much can we minimize the distance? So this one and that one. Yeah, so how many we schedule and so how can we reduce the distance? And I think with a solver, we want to maximize that distance value here by ensuring that the capacity needed doesn't go beyond that 2,000 bed days. So that's where we do data and solver. And we set the objective O13, which is the distance we want to maximize. And we change the variable cells, which is the how many. So the how many is that what our solver should determine, that vector. Is it 15 or 20 of this category or that category? And the constraint, what we add is, we want to make sure that these how many are integers. And I click on add, because I just want to add that as a constraint. And then what we also want to ensure is that capacity needed is less than or equal to the total capacity that we have available. Okay. And what we make sure is that we have simplex as solving method, and then let's try whether that gives us an answer. We just hit solve. And in this case, what we have found out is that it would, because these patients are far away, it would maximize that number of patients. It would prefer these patients and give them that patient type or the capacity. Now, what we could say is actually we want a little bit of a mix of patients. We want to say patients who live there should not take overall capacity. So I want to limit these patients to, let's say, 200. So what the solver should do is it should take into account that with another constraint that these guys here are, how many are less than or equal to, and then we could say solve, and our solver would do would then probably prefer the next patient type, which is this, what is that, 5 miles distance or 5 kilometers distance. And we could go all the way down with even further constraints and say we want to make sure that these number of patients are kind of our target patients, and we could also say, okay, for these patients we have monitor needs, and we could say actually our monitor capacity here is the sum product between these how many people we schedule and the monitor needs. So that is the total monitor capacity required, monitor capacity requirement. And we also have the monitor capacity, which is maybe only 100. So this could tell us in our solver that we want to make sure that these guys who require the capacity is less than or equal to this total monitor capacity available. And then we can resolve and see that this mix becomes now even like more different than to the first one. And we can impose a limit here, and we can just work on, and then we can also think about what about capacity expansion. So if we expanded that total ICU capacity from 2,000 to, let's say, 2,500, what happens then with our mix of patients? We could even say, let's assign these people to different hospitals. So patient type number 1 should be 20% go to this hospital, 60% to that hospital, and the remaining 20% to the third hospital. We could also do that with a matrix then. So this would become then 2-dimensional with multiple hospitals then. That's what the solver would tell us then. If we had in hospital 1 only, let's say, 100 capacity, but in hospital 2 we had monitor capacity of 300, etc. So that's what we could impose to the solver as additional constraints. Is that solving your problem, kind of? Or, sorry, I'm looking in the wrong direction maybe. if I think, I think what I could suggest is, I think it's a really interesting problem what you have, and if it's something that you really want to use or want to develop, I think I can write on a project description and find an MSc student, like a master student, who I could supervise and work with you. I think you don't need to send us data or anything. We could just develop the tool and we send you the tool and you plug in your data. So that's a way to avoid, any data sharing agreement. We don't need a data sharing agreement, but I would just send you the tool. We would work on a tool, send that to you with OpenSolver on a normal Excel solver, and then we can work on that together if you like. I don't know. Yeah, of course. Yeah, of course. Yeah, that's why we are here to find, collaborations or things to work together if there are multiple. Like, I think it's really interesting to find a multi-hospital problem, multiple ICUs, multiple patient types, one needing monitors, one patient type needs more capacity, some less capacity, some are really complex cases, some are more easier cases, but they need just long ICU stay, and some need specialist treatment with nurse maybe an elderly patient-focused nurse, and some people more pediatric nurse, some pediatric doctor, some care of the elderly doctor as well. So I think it's a very powerful tool that this provides, and something that I can, find like an MSc student who works 3 months over the summer with you on that project. Yeah. Is that, yeah? Okay. I think
Yeah, good. Good afternoon. My name is Ingrita. I'm in charge in immunization in Jakarta. I'm interested in your state about we collaborate in Google problem solvers. There's two major issue in immunization about I can find the root cause that why immunization in Jakarta pardon if I speak in Indonesia. Makasih ya. Ya, oke. Jadi permasalahannya adalah di DKI Jakarta imunisasi itu mengampu daerah-daerah yang lain, dan itu kemudian dijadikan suatu highlight oleh national government bahwa itu menjadi kekurangan akhirnya yang tidak mampu melindungi anak-anak di DKI Jakarta, sehingga masih ada penyakit yang dapat dicegah dengan imunisasi. Ini yang tadi saya berpikir bagaimana membentuk suatu model yang akhirnya bisa tidak hanya distinguish root cause dari berbagai macam asumsi, tapi juga mampu untuk memberikan suatu solusi yang terbaik untuk pelaksanaan imunisasi di DKI Jakarta ke depannya. Terima kasih Dr. Jesse atas bantuannya.
Thank you. The question is coming from Dr. Ingrita. The question is immunization in Jakarta also serving the children from area outside of Jakarta. This becomes a drawback because then Jakarta will be unable to protect the children in Jakarta. Okay. So how this solver could identify the root cause and probably distinguish the root cause and providing the solution to this problem. Okay, am I correct?
how we make those assumptions turn into data. We have a lot of dependent data, but we don't know what should we choose that independent data that will be back up to we choose that this is the right assumption. Yeah, the main.
Yeah, good question. Very good question. What we can impose on the solver is, what I did was an upper limit. You know, we can have at most so and so many patients of that type, or at most so and so many patients of this type. We can also have a lower bound, like we want at minimum number of patients served. Let's say in this category, this is we have upper limit here, but we can also say a lower bound, like a minimum number of people treated in this category. Let's say we want at least, what did you say, 30 children maybe? It could be of category 5 patients, right? And then we would say, solver, we add that constraint. We say this guy here must be, this guys here must be greater than equal to these guys there. And then we say solve. And then with this is how we could ensure that this capacity is protected for your children coming in from outside Jakarta. And then our hospital makes sure that these people are, that these little children are treated. Otherwise, we would give all the capacity away for the, patients that need more, like a lot of capacity, or they are like close to Jakarta. We don't want that. We want a good mix. And this is a kind of in strategic operational research for healthcare, in that literature, it's called case mix planning problem. So the case mix is patient types. You want to know how many patients allocate that capacity, how much capacity we need for these and these and these patients, and you can impose lower bounds. You need at least so and so much capacity for that type or this type, or cancer patients, or elderly patients, pediatric patients coming. You could say people who live very far away, that they have at least 10 of them should be in the hospital. So this is what you can all specify to the solver, and it would find the optimal solution within all these boundaries that you give it. What we have to make sure is that we don't over-constrain the problem. If you have too many constraints, then the solution space would be very, very small. If you add more constraints, and you have a minimum number of this and a minimum number of that, but a maximum number of this, it's a little bit like you do your shopping, and you want to go to this shop and that shop and this shop and this shop, but in this time window and that time window, and sometimes it's just infeasible. Picking up your kids, going to that shop, seeing your grandmother, and then doing housework and doing this and homework and bringing kids to bed. So you have too many activities that you have to put into your life. So that's where you have to make a compromise then, if you have too many constraints. But long story short, you can impose a minimum on an upper limit. Yeah, and again, I think it's the offer. If you want, we can look at that problem as well with an MSc dissertation. If you just want to contact me or Paul Harper with a little problem description, I'm sure we can help. At least write that problem together, and then we'll see whether we find a student that could work on that with a minimum and a maximum limit. And the nice thing is also we can show a map, which is I haven't shown you a location planning tool. It's FLP, and we worked on a tool where we had ADHD children in school, so children with special needs, and we had optimized in Wales who, sorry, that's the wrong file probably, how many people do we need and at which location these people should be. And you can see in a minute on a map that how that looks like if you use the solver and put that into a geographical model. 1 second, it just needs a little bit to open that spreadsheet. But does it answer your question, or? Yeah, I think Solver, we use Solver for forecasting as well with a regression model, because a regression model, what you want is to minimize the deviation between your forecasted point and the actual demand. So it minimizes, like the squared deviation between the forecasted and the actual demand. So you try to find a line and in the regression problem to make your forecast. But I think these days there are more elaborate techniques to do forecasting, like the Facebook profit, or econometric models that you could use, or machine learning models, that take into account all the seasonality relatively, like automatically with the forecast. It depends also on your forecast window. Is that 1 year forecast, 10-year forecast? How much period, like in how many periods you're looking at? Is that monthly forecast in the next 10 years? So I think I probably would need to like understand the problem a little bit more to kind of really. Simple and effective, you mean? I think it depends on what you're familiar with in terms of the tools. I think if you use an Excel model, yeah, I think I would be careful with the moving averages models, or I think I would be very careful with these, because I think you need at least some seasonality to be built in a good, I mean, quick and dirty model. At least a similar, like a trend and a seasonality, and then I think you have even more variables to consider. Yeah, I mean, and you can work on a forecasting model like for several days to have a good model, but and then you think about your data quality, whether the data that you plug into the model is even good enough. I think there is no perfect answer. What is the best forecasting model? I would say it depends on the. I think I would run different models and see what is the forecast error, and also the forecast metric is something you want to look at, because what I see in the literature, we see that usually literature tries to focus on one specific measure, like minimize the squared deviation between the forecast and the actual data. But when it comes to the decision, is that really a good measure? Because if you over forecast, like if you forecast that you have more demand than you actually have, when it comes to deciding on the capacity, that is then a different story as compared to underestimate the demand. Because if you're short in capacity because you have underestimated the demand, then you need to pull agency workers or bank staff, etc. So that is then a different question. So sometimes the metrics are, in terms of the forecasting, not useful, or like the classical metrics. That's why we try, I think, often to bridge the predictive models with the prescriptive models, like the models where we would make a forecast, of course, but then the question is, how do you decide based on the forecast, and which metrics you use for the decision? Because not all metrics will perform equally well. You can have the best forecast, but then you may have a really bad decision when it comes to capacity planning. So I think you have to be careful at the end and think about the actual question, probably. Yeah. I think probably, I think there's no quick answer, I believe. And it's problem dependent. Yeah.
Ibu, kalau dari profesornya sih materinya sebenarnya udah ya, karena tadi udah exercise pakai beberapa contoh. Ada yang, jadi kan ini kan tadi menjelaskan tentang data solver ya, jadi mungkin sebenarnya lebih ke untuk supaya kerja kita bisa lebih efisien ya. Jadi kalau misalnya kita punya sumber daya yang terbatas yang mau kita capai targetnya ada, nah gimana caranya memaksimalkan sumber daya itu. Nah, tadi yang kebayang di saya sih ya, contohnya kayak jadwal jaga, ruang rawat, kebutuhan alkes, gitu-gitu. Kalau dari Dokter Inggrita tadi memaksimalkan kapasitas vaksin yang ada nih, berapa maksimal anak-anak dari luar DKI yang bisa kita layani supaya yang di DKI tetap optimal dilayaninya. Nah, mungkin di program Bapak Ibu juga mungkin sekarang udah mulai kebayang ya bisa dipakai untuk apa. Nah, untuk itu dari audiens ada lagi yang masih ingin dieksplor nggak, ngasih contoh atau kita sudahi? Di online juga boleh kalau misalnya ada yang mau bertanya. Tapi tidak ada pertanyaan di chat room. Kok nggak ada sih? Belum dibuka itu sama laptop adminnya. Bapak Ibu ada yang mau ditanyakan? Atau cukup? Ya silakan, Ibu Roma.
Okay, thank you, Dok. I'm Roma, and actually I work in human resources for health. So my question around how to manage people. Yeah, I have a question about actually in human resources for health, we gather information very detailed about one person to one person. And we get it from our district from North Jakarta and then so on. So do you have references how we can gather all of data, personal data from each person, from each district, which last month I took the data. It's around 10,000 data person only for public health centers. So do you have references? Do we really need Excel or another application, because it made my laptop crash actually at that time. Just references for us, if we handle too much data, is it Excel or another application? Thank you.
Yeah, Excel or not Excel, that's the question. I think I can show you something. What I did, I ran into a similar problem a long time ago, and what I used was a tool which is called Weka, which is, I'm probably share screen. Weka is a really nice data mining tool, which was built in a university in New Zealand. So I think one of my PhD supervisors, where I was doing my PhD, I spent 3 months in Pittsburgh in the US, and they told me off from using Excel with my data analysis and things, and I also was using Java at that time with programming, and they said, okay, why don't you use Weka, because that has all the different programming interfaces, but also it has a nice visual environment. So this tool, and I'm happy to show you around that tool. It has an Explorer interface. So if you click on that Explorer, then you will see different possibilities. I think I need to share. Yeah. And this is where I think this relates then to the previous question, whether you should, what forecasting you should do and which is the best forecast, because this quite, visual toolkit has also forecasting, toolkit in it. So you can open a file. I'm not sure whether I can show you some files from the work I've been doing. I'm just thinking about whether they have. There are Weka files in somewhere. Maybe I could use this file to show you. This was a project where we looked into no-shows. Patients would not show up at a hospital for their appointment. So this tool, this data set has 13,000 patients on the top, and with Excel, everything that has beyond 10,000 lines, and in this case we have 14 columns, and all data is a mix of numerical and nominal, etc. But what you see in this environment or in this Weka tool is that you have a visualize component, and then you can see, for example, patients who not show up, which area they belong to. I think 0 is no show, and 1 is that they actually attend the appointment. So you can see here already, okay, in this area here, people probably are more likely to show up, whereas maybe this view shows the 12 months, and then you would see then in the darker spots that in particular months that people would show up or people would not show up, and then you can add here some jitter and some point size, etc. So I think what I would recommend is, if you have a really big data set that you need to kind of analyze and find variables that are, some variables where you want to make predictions, I would use like an environment like this that can process the data much more efficiently rather than Excel. But yeah, in this case, you have to make sure that all the attributes are, in the right, whether they are, categorical. Here, for example, we have a numerical or nominal category or nominal attribute, which is source of referral. People come from consultants, GP practices, psychiatrists, or wards or radiologists here. So it breaks down the whole data set. It's similar to a pivot table, but more in maybe a better way. And I think you can even run 100,000 lines of data sets or 1 million line data sets, and you can import that data from a database or from a CSV file that you export from Excel. So I can recommend that kind of Weka machine learning or data mining toolkit if you have bigger data sets. Yeah. Mm-hmm. Yeah, of course. Yeah, Paul mentions Python as well, SciPy or scikit-learn if you are in Python in programming. And these days, my first language is not Python at all. But what I did the other day, I asked Microsoft Copilot. Okay, you know Copilot? So I asked Copilot to create me Python code based on a demand distribution that I had from a different exercise. It put me everything into a vector, or in 2 vectors actually. I was able to ask Copilot to run me a t-test, whether one hospital has a different admission pattern as compared to the other one. And then I was able to do a capacity planning based on queuing theory with an MMC model, like a multi-server model, basically. And this turned out to be, giving me I was looking whether it was really doing the right job, but I was able then to copy and paste the Python code into an online Python interpreter, and it gave me the whole graphs, and it was perfectly fine. I didn't have to install any Python thing on my computer, which was great, because I have here, as you see, Eclipse down there maybe on my list. It's a Java platform, which is why I'm, as a Java speaker, I use that. But you can also use the online Python interpreters, and then you run that, and then you can use Copilot. Yeah, like ChatGPT or Copilot. It was really a good experience, and it did the job like perfectly fine.
Thank you, Profesor. Ibu Roma, oke. Udah kali ya. Ada lagi pertanyaan, Bapak Ibu? Kita tutup ya. Okay. All right, ladies and gentlemen, Professor, we have explored together the use of solver data with several examples, such as determining shift schedules, room requirements, medical equipment, enhanced work efficiency, etc. Hopefully, it will be useful in your respective workplaces. And with the conclusion of data modeling exercise or event for today also comes to an end. Heartfelt thank you to the experts from Cardiff University, Professor Paul Harper and Professor Daniel Gartner, and Mrs. Sari Bryce. Ibu Sari, terima kasih Bu Sari, penghubung kita ya. And also to the enthusiastic audience. Let's give a big applause for us. We hope the knowledge shared today will be useful. And on behalf of the organizing committee, I apologize for any shortcomings. Thank you once again, and I bid you farewell. Assalamualaikum warahmatullahi wabarakatuh. Let's take a picture together.